EHNAC is a 501c6 not-for-profit organization. We're actually founded in 1995, and we've started focusing at that point on the clearinghouses. And at that point, after the clearinghouses and we had gone through, we've expanded over the past several years into many other programs and focusing on e-prescribing, as well as financial services, medical billers, third-party administrators, health information exchanges. So we've expanded our repertoire of accreditation programs. We focus as well on a variety of stakeholders. So everything from, as I said, financial services organizations to e-prescribing networks to clearinghouses / electronic healthcare networks to providers, payers. And what we're trying to do on the provider side of the spectrum with some of our programs is really to raise the bar. Even though we don't have a specific program for providers, what we're doing is a lot of the accreditation programs we've developed have specific value to providers in relation to the fact that it raises the bar as far as what organizations that they want to look for that have what we would call our good housekeeping seal of approval in the industry. As a national organization, we're also recognized federally as a standards development organization. So the criteria, the standards that we use go through a very transparent, very structured process for approval. We have a public comment review process. All of our criteria is listed on our website. So any organization can go to it and see exactly what they need to do to become accredited. We focus on security, privacy, confidentiality. We also look at the operational and the technical aspects of an organization, and we incorporate a lot of the legislative, both at the federal as well as at the state level, into our accreditation. So all of our standards are very open, very comprehensive. We have a self-assessment plus a site review that we're doing. And it's a very consultative process that we go through to provide as well feedback to an organization on how they can look to expand, grow their business, besides going through all of our criteria. So it's a very structured process. Go through all that. It really raises the bar in the industry. We include best practices in our process. And as we develop our criteria, we have, as I said, a very comprehensive process of really transparency. So we go out for the public as well to get public input to any of our criteria, which we also factor into development for finalization of the various versions that we have, because we go through an annual release of each of the versions or accreditation programs that we have. So it's really about stakeholders. We're only focused on healthcare and healthcare organizations.